Just want to welcome everyone to this special webinar. I'm Brooke Baldwin, and we'll give it just a few more seconds for people to tune in the United States or all around the world. I have a special group of guests talking about something incredibly important and something we just haven't covered as much in the news and the headlines, shining a light on Syria and Syrians within country and of course in neighboring countries as well. So welcome to everyone joining me. We'll get rolling. I'm Brooke Baldwin. I'm here in New York City. I host a 2-hour live news show each and every day. And so for 12 years at CNN, I've covered a lot. But today, we want to talk about something, as I mentioned a second ago, that should be in the news more, and that is, of course, Syrians, right? We're all living in this unprecedented, tough time that is COVID-19 and the pandemic. I actually just recently was sick myself. The virus rattled me. I was one of the lucky ones and didn't end up in the hospital like so many people all around the world. And so I want to talk about those people, the Syrians. And so, and of course, we take so much of this for granted that we have in other parts of the world, face masks and food and soap, right? But, it's harder to come by in places like Syria. And so I have some extraordinary people who I'm honored to be able to help moderate a really smart discussion around all of this. And first and foremost is my friend and CNN colleague, one of our CNN senior international correspondents, Arwa Damon, who is there in her home in Istanbul. And when Arwa asks you to do anything, you just say yes. And so Arwa she joined CNN way back in 2004. She just showed up in Iraq and said, here I am. And ever since then, she has literally won every single award, a war correspondent. Arwa, thank you so much for asking me to be here. And she's the president and co-founder of INARA, which is International Network for Aid, Relief and Assistance. So we'll talk to Arwa through all of this. And then we have two doctors. We have Dr. Mufaddal Hamadeh, president of SAMS, which is the Syrian American Medical Society, having assumed the position just in July of last year. And so I'll speak a little bit more to him. He's been an active member of SAMS since 2011, serving as the chair of the Lebanon Relief Committee, president of the Midwest chapter, and treasurer on the board of directors. He has led more than 10 medical missions to treat Syrian refugees in Lebanon and led delegations of SAMS doctors to UN meetings and events in New York and Geneva. He is a board certified oncologist. He is a clinical associate professor at the University of Illinois, Chicago, and also operates his own private practice. And he lives in Chicago with his wife and 5 daughters. So Dr. Hamadeh, thank you so much for being here. And we will have, of course, she is in Idlib in Syria. And so the Wi-Fi connection is tenuous at best. Dr. Ikram Haboosh is an OBGYN and the director of the SAMS supported maternity hospital in Idlib. So without further ado, I want to jump our conversation off, but just a quick note for everyone watching, because this isn't just about all of us talking, this is about you getting to ask some really important questions. So if you have never asked a question on Zoom before and you're using Zoom to watch this, you can go to the bottom of this Zoom box where you will find a Q&A tab. Click on Q&A and you can ask us questions throughout this discussion, and we'll be fielding those questions. I'll help field those questions. Also, if you're watching this on a live stream, you can comment on Facebook chat, and we have all kinds of smart people behind the scenes working to make sure we get those questions to our panelists. So enough of me. Arwa Damon, because you got me involved in this, I'm starting with you, my friend. And let me just begin with, tell me a little bit more about you. I know the last time you were actually in Syria was just before the border shut, right? It was just before the COVID-19 pandemic really took hold. And I want you to just tell me why this is so personal for you.
First of all, thank you. Thank you for doing this. So glad you're doing better. This is personal on many levels. I mean, it's personal as a journalist because so many of us for years have struggled trying to tell Syria's story and really draw attention to what's happening in there. And I think for a lot of us who have been covering Syria, we ask ourselves over and over again, how did we fail to prevent this worst case scenario from happening? How did we fail to prevent all of the bloodshed? And then, we've all seen the images of what's happened inside. It's arguably the most documented war of our generation.
9 years, right?
9 years, nonstop videos by, extraordinarily brave activists on the ground inside. And then we all saw what was happening when the refugees flooded across to Europe. And yet that collision course that Syria was on, we could see it happening. We could see the rise of extremism. We could see the fact that ISIS was going to bleed over. We could see the fact that, all of these negotiations weren't going to go anywhere. And yet it seemed that despite all of the efforts of all of the journalists, extraordinary journalists covering this, we weren't able to shift the direction it was going in. And, it reached a point where, for me on a personal level, I had to do more. I had 4 years, not just in Syria, but in Iraq as well, been watching these kids fall through the gaps of medical care. And yet these are gaps that, I knew how to kind of fit together for them. You can find a doctor here, you can find a funder there. And it got to a point where I couldn't just report the news. I had to do more, which is why I started this charity, INARA, that really focuses on getting children who other organizations can't treat the medical care that they need. Because fundamentally, it's about humanity. Yeah. It's about witnessing these atrocities and wanting to do more than just saying, hey, can you tell me your story?
No, and it comes across in your reporting. And of course, we remember you and those extraordinary live images of you following these refugees as they were leaving Syria through these European countries. But how can your heart not be just, gripped so tightly by, of course, all of these children as well? And so just INARA and how you managed to run this charity in addition to being a senior international correspondent is pretty phenomenal. And we'll talk about that and why this is so personal for you. Dr. Hamadeh, can you just tell me, thank you for being part of this, and tell me more about the work at SAMS.
Thank you, Brooke. First of all, it's a great pleasure for me to share my 61st birthday with Brooke and Arwa and Ikram. It'll be a great day for me today. Thank you for having me here. A little collection. I have 4 daughters, not 5, but I wouldn't mind having a 5th and a 6th one. The daughters are unbelievable. They're great. They're wonderful. So SAMS is an organization that started in 1998. It is started as basically a social club. A club where Syrian doctors can get together, go back to Syria. They may participate in some training and educational sessions in cooperation with the University of Damascus. But then when the war started in Syria in 2011, we decided that we need to do more. We need to get into more of aiding, helping the people in Syria. Our first missions to Syria was started in 2011, and the organization itself transformed itself from basically a social club, a social society, to basically an NGO that started providing medical relief to the people inside Syria. So our budget in 2011 was about $750,000. It grew to a peak level in 2017 to $42 million. So during that period of time, we averaged, about 3 million services a year. And just last year, we had about 2.2 million services provided to people inside Syria. We relied on 3 different factors. First of all, our support here in the United States, which is our base, our members, our Syrian American doctors that are affluent, and they are very in top high levels, and the cream of crop of the Syrian society. As a matter of fact, for years there have been a brain drain from Syria to the United States. But these guys were able to support us with funds, with all different means, and then we relied on the U.S. government to help us through AFTA, so USAID. And we relied on basically the staff inside Syria and the people inside, the heroes, the real heroes inside Syria, just like Ikram, that you're going to be talking to soon, is the ones who are really treating the patients inside Syria and putting themselves at risk and basically being subject to daily bombardment, to recently subject to chemical weapon attacks. They risk everything they have in order to keep on saving lives. And so we relied on these guys and providing us support. And so we supported them. We actually supported at one time over 110 hospitals and healthcare facilities inside Syria. We provided the needs, equipment, the salaries, the support, everything they needed in order for them to keep on going on with their mission and saving lives. So that's in a nutshell what SAMS is and how it started.
Yeah, that's more than a nutshell, I would say, Doc. That's quite a lot that you have been able to do. Tell me, so the last time, correct, you were in Syria was just before the border had closed, and tell me what you had seen prior to then.
Yeah, it was just before basically Turkey shut the border because of coronavirus concerns, and it was just after the most recent ceasefire had gone into effect. So you'll remember, early on this year, there were those heartbreaking, mind-blowing scenes where you saw people moving en masse. I mean, this exodus, this traffic jam of humanity as people were trying to flee the regime and the Russian onslaught that was crushing another million people up against the border with Turkey into these camps that already had millions in them. And on our last trip there, we met people in the camps. We met people that had been crowded into schools. We met people at a school that had been bombed, mortared, just a few days prior to us arriving there. So people weren't even safe in these areas that they were seeking sanctuary. But more importantly than that, the conditions were just horrendous. And it was freezing cold. You'll remember, the stories of, babies freezing to death.
Yeah.
And so, you think about those conditions and you think about the fact that these are the people who are among the most vulnerable in the world who don't have access to clean drinking water. Look, if there is even a water truck that comes to the small little camp that they live in, if that water truck doesn't show up for a day, that's it. They don't have it. They don't have soap. They don't have any way to be able to protect themselves the way that the rest of us do. They are struggling on so many different levels. And then all of a sudden you tell them, oh, there's this thing called coronavirus, and here's how you protect yourself from it. And they'll say to you, I mean, are you kidding me right now?
Yeah.
How am I supposed to do this? How am I supposed to protect, my children from it? And so that's just, a snippet of what they're facing. Never mind the fact that even though, yes, right now this ceasefire has thankfully been holding, they have that constant fear in the back of their minds of it could start again at any minute, because they look back on their recent history and not a single ceasefire has properly held. So they're facing an enemy who they know very, very well with the bombs and the mortars and the explosions. And now they have a hidden enemy that they somehow have to try to hide from, but they don't have the tools to be able to hide from the coronavirus.
It's extraordinary. I think how you explained already, Syrians are already working from behind because of all the bombs, because of the lack of things that we take for granted, as I said, facilities, the soap, the food, the face masks. Dr. Hamadeh, again, as we work to get Dr. Haboosh connected, how badly has COVID-19 gripped Syria? Do we have any hard numbers?
Yes, but I just want to, piggyback on what
Sure.
Arwa said a little bit. I was in Idlib in January, late January 2020. And Idlib at that time was under bombardment. The healthcare facilities already have suffered tremendously. We have seen a significant shrinkage in the healthcare facilities at that time for several reasons. One is the fact that the some of them were lost with the loss of territory. Some of them were out of business because of being directly targeted by airstrikes, and also the safety issues. So we lost about 10 facilities, or we reopened 2. So there is, to start with, a very, very significant lack of existing healthcare facilities in Syria. The staff is under tremendous pressure. They were extremely worried about where to go from there and what's going to happen. The unknown factor was worse than actually death for them. And one thing that struck me as extremely unusual is the total apathy towards death and suffering. So, when you see people talking about death, and when I saw this one particular child in the ICU who had some brain injury, it was a minor brain injury due to shrapnel wound, and he lost 10 family members, 5 of them that day and 5 of them about 2 months earlier. And I talked to his brother, and I could see that there is total numbness towards death and suffering, honestly. So when COVID came about, COVID does nothing for them, really. I mean, they have seen much worse than COVID. There is, unfortunately, lack of appreciation what COVID can do. For them right now, the main comments I'm hearing is this is the first Ramadan we have without bombardment. This is the first Ramadan we had in 10 years almost without being, shelled and without the fear of airstrikes. So basically they are feeling a sigh of relief right now, because to them, COVID is on their back burner. It's not as important to them as surviving, the day-to-day basis, basically, as Arwa talked eloquently about the needs for clean water, clean soap, soap and hygiene and all that stuff. That is, totally missing there in those refugees camps. So
Doctor, if I can jump in, because I want to just underline what you just said. After you talked about this apathy of death, which I think is extraordinary, and we should talk about the fact that this has been the first Ramadan in a number of years without that fear, the visible fear, as Arwa talked about, right? The bombardment. In a sense, is this COVID-19, I can't believe I'm even saying this, but for Syrians, freeing?
For one thing, is the people in the Northwest have been under quarantine for a long time. They've been under isolation for a long time. So there's no added isolation. There's no traveling anymore. One thing we're seeing is the doctors can't move in and out because of restrictions on the Turkish borders. But they're not missing much. As a matter of fact, they are breathing a sigh of relief right now, because for them, they can be actually, they don't have to worry about the sounds of the jets and the bombs.
Incredible. That's incredible. And I would like to go to Syria. If Dr. Ikram, Haboosh, can you hear me now? Dr. Haboosh, can you hear me? Unfortunately, we can't quite hear her yet. Apologies to everyone. We're working on it because we so desperately would like to speak with her there in Syria. Arwa, what do you make of Dr. Hamadeh's point just about the notion in other parts of the world, maybe more in the Western world, where people are frustrated that they're having to stay home and that their way of life has just been totally uprooted. And for Syrians, that this is the first time that they don't live in fear of hearing the jets, of hearing the bombs, of, I think that's a fascinating, profound point.
It really is. What we don't know, and what we'll never know, is whether or not this ceasefire would have crumbled sooner had COVID not existed. And we don't know what's going to happen afterwards. But when it comes to sort of the psyche of people inside, just the way Dr. Hamadeh was saying, there is this sort of resignation towards death. There is this sense that they're trying to outrun death, but they have nowhere to go because, yes, they're effectively surrounded on all sides. And, Turkey has closed its borders, saying it can't take in any more refugees, a while ago right now. But I think the other thing that's also different this Ramadan is that in the past, you could apply, if you were a Syrian refugee in Turkey and your family was inside Syria, in one of these areas that, border Turkey, you could apply to go in and actually, spend some time with your family. They're not going to be able to do that this year. And add to all of that, because of COVID comes, the next sort of ripple on effect of it, which is humanitarian assistance. And that has been deeply impacted because funds are getting diverted elsewhere, because just the logistics of getting aid inside has become so much more difficult. And then even within these, small pockets that are still part of rebel-controlled Syria, you do still have an economic impact of the coronavirus. And they have shut schools down, or at least they've, tried to, the schools that were still open, not many of them. They are trying to convince people that they need to, socially distance, although that's an absurd concept to tell someone who lives inside an overcrowded refugee camp or underneath a tarp in the middle of an olive field. Is there PPE that you can buy at the local pharmacy? No, that doesn't exist there. So the dynamics that they're coping with are very different right now. And, in speaking to a number of doctors inside, they don't even have that many test kits. And that's a big issue, is coronavirus in rebel-held Syria already and we just don't know about it? Or has it somehow up until this point been spared?
Let me pause on to your question, Dr. Hamadeh. Do we have an answer to that on testing?
Yes, we do. The WHO were able to send 5,900 test kits. The only lab inside Syria is run by an organization, ACU Warren. And that is an NGO, and basically a non-governmental organization inside Syria. So far, we had 297 tests done in Idlib, in northwest Idlib, or northwest Syria, and all of them were confirmed negative except 4 that are still pending. So the 297 tests were done so far. In northeast, in the Euphrates Shield area, we don't have any test kits yet. No one was tested yet. But we have no documented cases inside the northwest area. In the neighboring country, just to give you a little example, for instance, in Jordan, we had 459 cases confirmed and 8 deaths. In Iraq, 2,153, 94 deaths. In Lebanon, 729 cases and 24 deaths. So the area hasn't been hit yet in a big way. Thank God for that. And it may never happen. Hopefully, won't happen. But I just want to elaborate on one thing that Arwa mentioned. Is I've been on several meetings on trying to design a plan for COVID inside Syria and in the northwest Asia. And to be honest with you, we really failed to come up with a plan that really can work inside Syria. I mean, yes, I don't want to discourage anybody from trying, but the fact is that our imagination failed to come up with a plan that really fits. Applying the same measures we apply here in the West, and in the United States, we question their efficacy anyway a lot of times, but still, they're not going to work there in Syria.
You sound very frustrated.
Yeah, and then obviously the how slow the plans are being implemented is extremely frustrating to me. Also, the fact that we've been talking about those plans for 7 weeks now, none of them was implemented. Nothing was implemented yet.
Doctor,
very minimal.
Let me ask you a question. We're getting a bunch of questions, and thank you all for asking them. I'm seeing them now, just on the same topic. Here's a question from an anonymous attendee. If the epidemic spreads, how do hospitals in Idlib have the capacity to cope? Doctor, first you, and then Arwa.
Yes. So there is no capacity in Syria right now. I mean, We have in northwest Syria, we have a total of 97 ventilators. We have 95 ventilators. 97% are already occupied, but people are already sick. The original plan that provided by the WHO was to build about 3 separate hospitals, providing 30 ICU beds with 30 recovery beds, 30 regular beds and 10 recovery beds. So a total of about 100 or so ventilators were supposed to arrive to Syria. The WHO is under tremendous pressure now. Funding was cut. So as a result, we're down to 30 ventilators that's supposed to arrive to Syria, addition to what we have right now. 1 facility only, but that has not happened yet. As of today, we have not received anything. And so there will be no, as a matter of fact, but the main problem for us right now, the main focus for SAMS is to protect the healthcare workers. Because if the epidemic starts in Syria, then obviously the people at risk are the doctors and nurses, the staff, which will, and those are the most precious asset we have to keep providing healthcare for the people in Syria. If those get affected or sick, then there will be a major disaster. So, but still up to date, we just had a very small shipment of PPE. We don't have adequate training. We don't have adequate PPEs to protect our staff inside Syria.
Arwa, do you want to answer that?
Yeah, I actually did a piece on this a while back, and I remember talking to the head of the Idlib Health Directorate, who just said, you know, we're bracing ourselves for a tsunami. And from his perspective, it wasn't a matter of, you know, if it hits, it's just when it hits. And they don't have anything to fight back. I mean, that's the problem. And add to it, remember, especially for those who are part of the, you know, internally displaced community who are already living in these camps, these are areas that already have rampant disease. These are already people and children with compromised immune systems to begin with, many of whom, you know, don't receive the nutrition that they need. So their bodies themselves aren't as capable of fighting the way that, you know, kids or, you know, even what we call healthy adults are, you know, in other places as well.
They're already 5 steps behind. 10 steps behind.
Exactly. I mean, look, if we're talking about what's happening in the regime area, they have confirmed a number of cases, but we don't necessarily know how reliable those numbers are or how widespread the testing is at this stage. But I also should add that, you know, if this war has taught us anything about what is going on inside these hospitals, these medical teams and everything, they are so innovative. I mean, I remember doing stories about, you know, an internal medicine doctor who was doing brain surgery. People create ways because they want to live. And there are teams inside rebel-held Syria right now who are trying to build ventilators from spare parts that they're, you know, scrounging up from here and there. So there is this, you know, innate desire to want to give yourself the tools to fight back. But unfortunately, when it comes to Syria, the reality is such, whether it's Syrians in Syria or for many of the Syrians living in neighboring countries, that your own fight can only get you so far. And that's where and why outside assistance is needed.
Right. I love though the notion of innovation and the will, the fight to live and to make sure others live as well. I've got a question from Jet Wilson, someone who's watching. Jet, thank you, because, you know, we talk, of course, about within Syria, but also, Arwa, as you mentioned, you know, you've both been to these camps, and the question is, how widespread is COVID-19 in the camps already? Are doctors and workers in the hospital having access to PPE?
So no, as we mentioned, there is no going back to the camps. So in the northwest Syria, there are many camps there, but there are 1.1 million people displaced in camps, and the total population inside the northwest area is about 4 million people. No reported cases in the camps. If you talk about the biggest camp population, refugee population outside the northwest area is in Lebanon, obviously. And in Lebanon, many refugees, not all of them, and maybe about 40–50% of them live in small camps scattered throughout the Bekaa Valley and inside Tripoli and southern Lebanon. We in Lebanon, there are few cases, but within those population, the refugees inside Lebanon, they were able to identify only three deaths due to coronavirus. And some of them were not actually refugees. One of them came from Iran. So 3 Syrians died in Lebanon. But talking about that, about the situation of refugees in camps inside Lebanon, they are facing unbelievable hardship. And their situation could be even worse than the situation in the Northwest, because right now they have an extreme restriction on their movement. They can't go out to work. They can't leave their camps. And they're being victimized by the assumption that corona is going to come to Lebanon. It's going to come through those Syrian refugees. They're being treated harshly by the Lebanese, basically, we'll call it gangs that are guarding those camps and not allowing the Syrians to leave. And the only provider for services for the Syrian refugees inside Lebanon is UNHCR. And UNHCR is already under a great stress. They have developed a plan that ranges between awareness to training to isolation to actual treatment, that actually the treatment, there is no capability of applying any of the treatments that could be overwhelming the system inside Lebanon.
Sure. And I'm going to come back to you, but let me, oh, nope, she's not there. Dr. Ikram Haboosh, I'm told you can hear me and where your microphone is working. I'm having a really hard time hearing you, and I bet I'm not the only one. Trying to hang on to every single word of yours, but maybe we can work on having a bit better connection. I think there's an echo between your phone and the computer. So I appreciate you and your patience. Let's try to improve the connection a bit more, and maybe we can just have her call in. Arwa. And I know also before we even started this webinar, we have photos. I think it'd be helpful to see some of the photos. I know, Arwa, that you sent in, or other photos, and we can talk through just the situation on the ground in Syria. I couldn't quite make out anything that Dr. Ikram had said, but Arwa, what are you thinking right now?
Muted, no. Oh, no.
There we go.
When I first realized that, COVID-19 was in the Middle East and it hit Iran first, I began having waking nightmares about what was going to be happening to all of these vulnerable populations. Knowing the conditions that they were having to live in there, knowing that the way this was spreading everywhere, every country is looking to try to save its own people. And what happens to the populations in countries whose governments aren't going to be trying to save them? And this isn't just, relevant to Syria, it's to vulnerable populations all over the world. And then of course, so my charity, INARA, normally we do surgical interventions. We take on cases, that others don't. But the other apparent thing is that with these lockdowns, people were losing their jobs. Everywhere around the world, people are losing their jobs. For the refugee communities, that are both in Lebanon and in Turkey, the loss of work means that there's no food on the table. It means that you can't eat. It means that you don't have soap. Even though you're not in the war zone, you still can't afford soap. So we had to pivot very quickly and try to do something of an emergency, appeal to try to get, as many hygiene and food kits as we could to vulnerable refugee families, including families who we treat, who were living in these neighboring countries, because it's all happening so fast. I mean, and for a family that's already vulnerable, that for, in the case of INARA, for example, that's
and as you speak, Arwa, if I can just jump in and tell everyone, yes, can we see some of the photos? I know you've sent in some of the photos that you or your team have taken with INARA. I just think it's important for everyone watching just to see these faces. Go ahead.
Yeah, so for, you know, a lot of them, you have the trauma of war already, and you're in theory in a country where, you know, you're safe. You've finally fled the war zone. And then on top of that, you're all of a sudden being told, hang on a second, you're not safe here. There's this thing called coronavirus, and you need to be careful of the air you breathe. That re-traumatizes these children that have already been horrifically injured by this war. It re-traumatizes their families. And so, you know, we were trying to scramble to get, you know, as much assistance as we could, just to at least let them know, you know, hey, listen, like, here's your soap, you know, you can wash your hands, you can stay clean, here's your basic food package. And a lot of, you know, the families were telling us, you know, until you delivered this to us, we were eating bread and drinking, you know, water. That's all we had. The problem is that, you know, what we're able to do and what the humanitarian community in general is able to do for Syrian refugees in neighboring countries inside Syria is a fraction of what is actually needed. There's the UN's emergency appeal that has been put out there. They have only managed to raise a small percentage of what they actually need to deal with all vulnerable populations. And as we keep hearing over and over again, we're only as strong, globally speaking, as our weakest link.
So true.
And we can't afford to leave, you know, these kids, to leave these vulnerable populations everywhere without a lifeline again. We've already failed them so many times. Are we gonna fail them again?
It's the question. I just wanted to sit on that for a second. And I'm seeing so many comments. Dr. Hamadeh, back over to you. Arwa, that was beautiful and so real and poignant. Dr. Hamadeh, to you, I'm seeing comments of thank you both for being on and what can we do? And I know, you know, there was frustration in your voice over trying to figure out a plan and not being able to, but for the people watching right now, what can they do to help? Hang on, doctor, you're muted. Let's go. There we go.
Okay.
Here we go. What can we do?
So Arwa said it right, and then she did a good job explaining the situation. But most importantly, I just want to add one thing in terms of numbers. The World Food Organization provides assistance to every refugee in Lebanon, an average of $19 a month. The Lebanese lira lost 65% of its value, but the Lebanese government pays them not in dollars, in liras. So they already lost, that assistance was cut by 2/3 now, right? People can't find food in Lebanon and the refugees to be able to provide to their families. They can't work. They're in dire situation. SANS is basically a medical relief organization that really concentrates on medical relief, and we have done a tremendous job over the years. But I think what most importantly to me is what people need in Syria is they need that the world know what's going on with them. They need the world to care about them. One of the questions I'm asked when I go there by the medical staff is, can you, doctor, explain to me, does the world know what's happening to us? And I say, yeah, it's available. It's already there on social media, and it's available for anybody to look at. But then the next question I'm asked, so why don't they care? Why don't they do anything about it? And that is the toughest question to answer.
What do you say?
Because I really don't. What you need to do, we need to care. That's number one. We need to pay attention, and then support many of the organizations, the wonderful organizations that are trying to help out the Syrian people, but raise it up in the media, like just what Arwa is doing, just like what you're doing right now. Talk about it and try to stop the atrocities that are happening towards the Syrian people and stop just give them a chance to live, basically.
We need to care. We need to shine a light. I'm getting a question. Doctor, I want to stay with you. Here's a question from someone watching. What can we do to provide soap and basic necessities to Syrians? Is there any way that people watching can help?
Well, yeah, by donating to some of the organizations, donating to SAMS, and I think we will show our website is sams-usa.net, donating to INARA and many other organizations. Your assistance will go directly to help our Syrian refugees. SAMS has an extremely unheard of low overhead of less than 9%. More than 91% of your donations will go directly to help the Syrian people. We have a campaign to help the people in the region, including the people in Syria. We actually donated almost $100,000 to the people in Jordan. We had about $25,000 donation in PPEs to the people in Lebanon. And here in the U.S., we're running a huge campaign now. Hopefully, we're ambitious to be able to collect $200,000 to be able to help the heroes that are providing the healthcare heroes that are providing help to save the lives of people with COVID here in the United States.
And Arwa, you did a distribution in Lebanon and Turkey?
Yeah, we did. I mean, look, what we were able to reach is, a fraction of the need that's actually there. But in doing that, we were at least able to send a message to, some of these families of you're not alone. Because building on what, Dr. Mufaddal was saying, when I go into these areas as a reporter, especially inside Syria, people say, look, you've been filming us for 9 years. I mean, what's changed? Why should we talk to you? And, what do you say to them? You can't tell them, oh no, if you give me an interview, if people actually see your plight and what's happening to you, things are going to change, because you know what? It's probably not. The only thing that we can tell them and that I tell them is, you know what, look, if you talk to me, if I film what's happening to you, your situation probably isn't going to change. But we can't stop fighting to try to change it. If we stop trying to report what's happening there, if we stop trying to fight for these vulnerable communities, look, whether it's through telling their stories as a journalist, or whether it's, work that we do as a charity, or work that SAMS is doing as a charity, what then is left of us? And that's really, kind of what it boils down to. And I think, what COVID has done is bring all of these various different issues to the forefront. Let's say, hypothetically speaking, that somehow rebel-held Syria is spared a coronavirus outbreak. Who's going to spare them from the side effects of it, from the lack of funding, from the fact that the humanitarian aid that they're so reliant on is all of a sudden going to disappear because the global economy, let's face it, is crashing? Who's going to help support them in, the neighboring countries, when as these neighboring countries' economies try to, at some point in time, revamp themselves, they're going to be looking out, understandably, for their own citizens, to put their own citizens to work first. So who's going to support the millions that are living in neighboring countries trying to feed their kids who are already doubly traumatized by everything that's happening? Which, again, is why we need a bigger, more coherent, international effort to focus on these kinds of populations.
To that point, I'm going to pose a question right back to you, Arwa. This is from Senka. Arwa, I work for an NGO that operates in Syria, among other countries, and I do fundraising and partnerships to help support our work worldwide. One of the most frustrating things is donor/public fatigue related to Syria, right? This is what you're talking about. How do we, as a humanitarian sector, break through this increasing apathy, especially as the world is turning inward?
I wish I had the answer to that question, because, we face it as INARA, as a charity, and we face it as journalists. How do we get Syria back into the news again? We as INARA, we keep trying to tell, the stories of our individual kids and what we're doing, and we keep trying to push forward, this message of, look, it's not just about getting a child a surgery. You change their life. They go back to school, a lot of our kids who aren't in school. a lot of the kids who are in school who've been injured are bullied. Once they start getting treatment, they get their confidence back. And then once you're able to treat a child and then you demonstrate to that family that they're not alone anymore, that transforms the entire family. We have, unfortunately, to try to, raise funds for INARA, we've had to shift from the argument of we should do this because it's the right thing to do. Like, it is literally the right thing to do to medically treat a war wounded child, to making an economic argument. When a child is wounded, it takes, 2 to 5 adults to care for that wounded child. Once that child starts getting treatment, that's 2 to 5 adults who can all of a sudden go back out and join the workforce, who are transformed from being an economic burden to actually being an economic contributor, whether it's in a host community or back in their homeland. You take that injured child from being someone who's going to be, reliant, potentially permanently, severely disabled, and unable again to contribute economically, to one who's going back to school, who's got new motivation, who hopefully, because we've shown them that the world isn't just about cruelty, that there is kindness and compassion and people who want to help them, might end up doing something phenomenal to help others that we can't even predict.
Dr. Mufaddal, do you want to add to that?
Yeah, that was an unbelievable question, because I wish I could have a satisfactory answer to that. But I think one silver lining from the COVID epidemic, pandemic, is we all learned now that what happens anywhere else in the world matters to the whole world. The whole world is a community now, a small community, and we have seen what the effects on the world, what kind of effects on the world happened when this thing started in a small area in China. But what matters, what happens in Syria matters to everybody, to all of us. Going back to what happens in atrocities, and we as a community, an international community, have vowed that the Holocaust will never happen again. We said that Srebrenica should not happen again. Rwanda should not happen again. Yet we allowed it to happen. And we have seen a failure of leadership in the worldwide to stop the atrocities, stop us from coming from where we were to where we are today, all right? And today, another epidemic starts in Syria, another epicenter in the world starts in Syria, and may have a ripple effect on the whole entire Middle East, which will affect every single one of us. So when we allow these things to happen and we turn a blind eye and a deaf ear to the cries of the injustice, then this is going to happen again. It's not going to happen only in Syria, but next time it's going to happen anywhere else in the world. We allow this to happen. So we need to make sure that these things don't happen again. And we should stick to our standards that we thought we got to live by in order to, not be affected by these events down the line.
Is there a sense from either of you that there is any hope? Arwa, first to you.
Look, me, I'm a very cynical person. Here's one thing though. So again, when we did this sort of COVID fundraiser thing, the response was actually very impressive and I was surprised. And I think there's a portion of the population out there that has perhaps a certain degree of, more empathy and compassion for those who are in less fortunate circumstances. We all have had and are having our individual experience with, COVID. And we can imagine what it's like to go through that without certain luxuries that we have, like soap and running water. People are afraid of, the coronavirus. They can imagine, how much more that would be amplified if you also had to deal with X, Y, and Z. But what that actually means to the long term, will those who are feeling, more for less fortunate communities carry that with them to the other side of this instead of eagerly wanting to jump back into their lives? That I don't know. And I keep wanting to see humanity move in a better level. And I keep hoping that it will, but I think, we have to deal with a reality and at least prepare for a scenario where it doesn't. And that's where it's going to take, all of us, all of our efforts. to rally for those who are most in need. And that's where it's going to take, frankly, all of the efforts of anyone who's listening, people who are watching, to try to rally to help those most in need. Because if we think that governments are going to all of a sudden jump in and start doing the wrong thing, I mean, that's just, I would love for that to happen, but I don't see it. So it's on us. It's on those of us who have found maybe a greater degree of humanity in all of this to translate that into something when we're on the other side of this virus.
It's on us. Last question to you, Dr. Mufaddal. Where are you hopeful?
Well, whenever I'm down and I feel doubtful, I drive my inspiration from the people of Syria, particularly the kids in the refugee camps and the kids, the Syrian people in the Northwest. And all what you need to do is spend a few minutes with them, and you see the joy in their eyes, and you see the hope for the future. The people of Syria always give me a juice of hope and optimism because of their perseverance and their basically their bravery towards the most difficult circumstances that anybody could have lived through over the last 9 years. So yes, there is hope, and I'm very, very hopeful. Things will do better for Syria, and from the darkness, there will be sunshine coming out, and it will be in the future, hopefully, and we will see freedom, democracy, and better life for many of the people in Syria. I'm hopeful that the pandemic will not actually spread to Syria. A few factors that are in their favor. One of them is they're mostly younger population. So we know that hopefully that it will affect the younger populations much less. About 80% of people in Northwest Syria are under 40 years of age. And then the fact that they have been isolated already for a long time. But most importantly, I think after this whole thing is over, we need to start looking for a brighter future for the Syrian people.
I appreciate both of you so much, and for everyone watching, once more, if they want more information on your organization, SAMS, where do they need to go?
SAMS-USA.net.
Okay, and Arwa, if they want more information on your organization, INARA?
INARA.org. And just quickly, just on the point of the children, I mean, like Dr. Mufaddal is saying, there is very little that is better than actually seeing a child who has suffered so much start smiling again.
With that, I want to thank both of you, and I want to thank all of you for tuning in. We can do better, and we care, and there is hope, but it could be a long journey ahead. Thank you very much, everyone. I'm Brooke Baldwin here in New York City. It's been my honor to help moderate this important conversation. Be well, be safe, everyone. Thank you.
Thank you.
Thank you. Thank you both.